America is in the middle of the worst public health crisis she has ever seen. Accidental overdose is the #1 cause of injury death in our country. The age of first use of drugs and alcohol is lower than it has ever been. Someone dies of a drug overdose every 9 minutes. About 120 people every single day. But we can't only measure this crisis in death, for it's much bigger than that. Over 17,000 people go to emergency rooms on a daily basis. Over 4,000 of those daily visits are for pharmaceutical drugs. Over 200 of those visits are for children under the age of 18 every single day. This is a problem. It's our most serious health problem, and for years we've been talking about it, casting blame, looking for answers, wondering how we got here, sweeping it under the rug, allowing stigma to get in the way of real solutions. Well, there are real solutions to this problem. But if we as a country continue to accept these social costs, this loss of life, the misbelief that we can't do something about it, we will never see an end to this epidemic. Everyone, and I mean everyone, must collaborate to solve this problem. Everyone has to be at the table. Everyone has to work together. We cannot piecemeal our way through this. There must be systemic and far-reaching changes. They must happen now, for this is truly an epidemic.
It's a staircase effect, you know? You start out small, like you eat mushrooms, then you eat acid, then you do DMT, you do Xanax, you do Percocet, you do, heroin.
But this just wrecks it. It's just like a wrecking ball that comes in, and it's a roller coaster, and there's no end to this.
It's in every family, every school district, middle class, low class, we're all affected.
I mean, for somebody to think that they can go out and say that they don't have that problem, it's a joke, they have to be laughed at. It's everywhere, it's everywhere.
It's just not worth it, because at the end of the day, if you decide to go down that road of drugs and alcohol, there's no telling that if you're gonna come back, A. And if you do come back, are you gonna come back yourself?
We come from a very good family, strong family. We don't have drinkers, we don't have addiction in the family.
I mean, smart guy, athletic, just so much potential. Just, you could tell he was gonna do something awesome.
Abby was, in general, a good kid. She was a good kid, and she didn't go without, that's for sure.
Danny was a typical teenager. He was in sports, he went to school, he had a part-time job, he had a lot of friends, he had a girlfriend. He also had a secret life when he was with
Justin was very charismatic, loving, caring, very affectionate, very smart. He was a 3.0 student at Drexel, Syracuse University, and Temple.
He was, captain of the football team. Everybody loved him, big man on campus, lots and lots of friends.
He was just a charmer, and you would never think that he would do that.
Yes, opiates. There was actually a combination of Oxycontin, Vicodin, and Xanax in his system when he died. He was 19 years old.
I mean, no one is immune to addiction.
And they're kids, they're going to experiment. They do not understand. They do not understand what line they've just crossed.
He just had no control. No control. He obviously that was not the person he wanted to be. But he couldn't fight it.
It's like having a constant sword hanging over your head. And you never know. You never know when the phone call is going to come. That's going to be the last call.
you might make the choice to do it the first time, but with opiates, you know, or heroin specifically, you're done. I mean, you're hooked.
And what we started seeing happening was the use of these painkillers like hydrocodone and oxycodone, oxymorphone, and codeine being used as a crutch to get through everyday life. And that crutch turns into addiction so quickly.
The schools need to stop denying this stuff. It exists, it's there. You know, what they should be doing is asking for as much help as they can get. Getting as many programs in there, after school programs. Nobody wants to deal with it. Nobody wants to deal with it. Let's just shuffle them off.
I was just going with all the stuff that was coming at me while you're still in the state of panic. A mom is a deer in the headlights panic constantly. And so like when we got to the hospital and they handed me that piece of paper and they said, he's got to call for a bed. And I was like, wait a minute, he's incapable of doing anything right now. He was dead 12 hours ago. How do we do that? And they said, this is the way it works. We don't help you.
The other 4 rehabs that I went to, they didn't help at all. Their main goal was to get you to come back after they released you. That's the only way that they get paid.
In New England, one of the big things is prescription drugs, and just seeing how loosely they can give them out and how easily they're attained. You know, I think there's a lot of things that we can do to prevent all of that.
Why would we ever want to introduce a drug that is going to so adversely impact the future of our nation? So, you know, it's alcohol is bad, heroin is bad, anything that changes this brain chemistry and really alters our motivation, our quality of life, our emotional regulation. Why would we be in favor of it? It just confounds me that this is the direction we're going in.
When you're playing Russian roulette, you know what I mean, with opioid prescription painkillers, you know, you're playing Russian roulette with your life.
It's devastating across the board, and I don't think anyone's stepping back far enough yet to look at what that big picture is.
We all should be concerned about it because it's our loved ones, our parents, our brothers and sisters, and our children. This is everybody in America who is affected by this.
So there are a lot of myths and misconceptions, and I think really the question is, are we going to learn from our mistakes from the legalization of alcohol and tobacco?
If you really can get a hold of the kids at a good age, around 7, 8, 9, 10 years old, and teach them what self-worth and self-value is all about, you can prevent it.
You cannot use a siloed approach to addressing this problem. You cannot ask teachers to address this problem for you. You cannot ask law enforcement to address this problem. You can't ask parents to just be better parents and we're gonna solve this problem. It doesn't work that way. Unfortunately, there's so many influences on young people and even adults that need to be addressed. And so through, I think, working together and changing the norms and educating and changing policy, we can make an effect on this. But I think it's going to take everyone getting informed and doing their part.
In my opinion, this is about being involved. This is about going to those community forums, listening to people talk about like the problem, but then standing up when the time is right and saying, okay, well, what are we going to do about this? Like, what are we going to be doing on a community level? And in order to do that on a community level, that requires us as individuals to be involved. That means that we have a responsibility for ourselves and for the people that we love and our communities as a whole and society as a whole to do something different. And to focus on the solution and figure out what that solution is. And if we don't do that, we're gonna see people die. You know, kids are gonna keep dying, people are gonna keep dying, and if we're part of the problem, then we're not part of the solution, and it's time to be part of the solution.
We traveled across the country, visited so many states, north, east, south, Midwest, west, and we talked to people that have been directly affected by this problem. This problem is everywhere, every community, every socioeconomic, every demographic. It's affecting everyone. It's an American epidemic.